Hi, my name is Dr. Rajesh Shah. I am a director of Life Force Homeopathy, where we treat patients of various diseases from world over. We'll talk about vitiligo. After having treated over 7,000 cases of vitiligo from each and every nationality in this world, we have learned a lot of things about vitiligo. One of the common experience that we have with the vitiligo patients, regardless of the country they come from, is that vitiligo lowers their self-esteem or self-confidence. Most patients, they tend to feel embarrassed by this disease because of the looks they change with a few spots of loss of pigment on the skin on certain parts of the body. It is quite understandable. However, the challenge is that we have to transform from embarrassment and learn to embrace this disease in such a way, with such a grace, that we should not be affected by this disease which otherwise is medically not so significant. I do understand that it is easier said than done when we say, okay, take it easy, or don't feel embarrassed by this disease, or don't let the disease, not lower your self-esteem. However, when it comes to doing it, it is a bit tough for especially younger people, and more so with females when they have a spot or two on the face or on the hands. I have seen a lot of young executives having vitiligo on the hands, and they are hesitant in shaking hand in the business meetings or while giving a presentation. They are embarrassed, when they tend to show their hand, which might have spots of vitiligo. How to overcome this? Well, in my opinion, it is very important that we understand vitiligo. Vitiligo being not a serious or a dangerous disease, we have to, or the patient having vitiligo has to learn to accept this disease as a part of the body. One has to know that vitiligo is not contagious. One will not spread this disease by touching anybody else. It does not bring any suffering, any pain, any discomfort, any itching on the skin or to the body. So one has to accept that this is simply benign loss of pigment on the skin, and it is not a serious problem. Once that is fixed in one's mind, then it becomes easy for a patient to accept the disease as it is. One should realize that most people on this earth have some kind of physical or psychological disorder or disability or disease. Some of the diseases are visible. For example, somebody may have skin diseases like eczema, psoriasis, vitiligo, and so on and so forth. And most other diseases, they may not be visible, but they may be much more serious in the form of the impact they have on the health. For example, diabetes, hypertension, migraine, colitis, and so on and so forth. Vitiligo relatively is much easier, much milder disease as compared to many other counterparts of other autoimmune diseases that one may have. So the patients having vitiligo have to first understand that vitiligo is a minor ailment, it is not a serious problem. Once he accepts or once she accepts this disease, then it is easier for other people to accept your disease. If you do not accept your disease at the first place, then how do you expect others, your friends, your relatives, your subordinates, or your colleagues at the workplace to accept your disease? So once you learn to be confident about yourself, about your disease, then only you will not draw attention of people on your spots. If you are very conscious about your spots, then you might think that everybody is looking at your spot. If you are confident, then you will stop caring for others having to look at, looking at your spots. So it's very important that once you have a clear understanding about the nature of this disease, which will help you boost your self-confidence. And once your self-confidence is taken care of, then you will not really care about what others think for your vitiligo. Surprisingly, I have also come across a number of young individuals who have vitiligo and they have accepted this disease so very well. in a very impressive manner, and they just simply don't care. They say, okay, I have vitiligo, so what? Many people have many other diseases, and I am blessed with vitiligo, which is not giving me any discomfort in my physical well-being. So my suggestion to the patients having vitiligo and to the parents whose children may be having vitiligo is to help them boost their self-esteem, their confidence by accepting the disease, by understanding the disease. That's the best way to boost one's self-confidence. Hiding the vitiligo patches with the use of camouflage is a social measure that many people like to opt for. But if you ask me personally, and my very personal advice to my patients is to not even mask it by the use of camouflage or makeup, but to accept it. The moment you mask your vitiligo patches, in my understanding, it is nothing but amounting to speaking a lie. When you mask your vitiligo patches in front of other people, it means that you are trying to hide it. And why should one hide it? You should hide it only when you are not comfortable with yourself. The moment you are comfortable with yourself and with your vitiligo, then you do not see a need to hide your vitiligo patches with makeup or with camouflage. So learn to face this problem. This problem is not a serious disease, as I have been shouting since many years. Learn to accept it as a part of your body. I am sure this will help. Thank you.